Welcome back. On today's East Jefferson General Hospital Medical Moment, Camille Whitworth introduces us to Dr. Michael Brothers and the many advances in surgical techniques to limit the transfusion of blood and blood products.
Imagine having surgery and not needing a blood transfusion. It's hard to imagine, we know, but it's happening here at East Jefferson General Hospital. And today we speak with Dr. Michael Brothers, and he tells us all about these groundbreaking procedures.
What's happened here over the last few years, if we've developed techniques to avoid giving blood or blood products at all, there's still blood loss, but we manage the volume of the patient. The benefits of not having a blood transfusion are enormous, not to mention the cost involved. About 10 to 12 years ago, we started doing lung cancer surgery with different techniques that for the first time allowed us to do those cases with almost no blood loss, and we continue to do that today. It's only in the last 2 or 3 years, it's been a group effort to streamline the use of blood products in cardiac surgery, and perhaps 90% of the open heart surgery cases I did last year received no blood products at all. This is not zero blood loss, but the important thing is that we not give you blood or blood products. Many years ago, certain religious groups were very concerned about receiving blood, and I would say many cardiac surgeons avoided those patients when they could. And now we're actually looking more at embracing those patients because I believe these techniques are available to them.
Is this really the surgery of the future?
I think it is the future. Now, the benefit is more than what might be apparent at first. Not giving blood products results in lower infection rates. It results in less renal insufficiency or kidney damage. We also are using less ventilation times. The patients are not intubated with the tube that they all dread, sometimes only for a few hours instead of a day or several days as it was common in the past. One of the reasons for this is that the techniques that we use have the side benefits of avoiding a lot of volume. We used to think a lot of IV fluids were good for you. We used to think that a lot of ventilation was good for you. And we thought that higher blood counts were necessarily good for you, and that's not the case. The hospital is also embracing this now on an area-wide basis, and our lead champion for this is working on accreditation to be one of the few hospitals now in the nation that are using these concepts across all surgical procedures. But we're not quite there yet.
This really is exciting news.
I think it's very exciting. It's exciting for us, and it's very exciting for the patients. Also recall that the blood bank very often is in dire need of blood and donations, and we historically have been the big users of blood in the blood bank. So it makes common sense if we cut out the majority of blood products in open heart surgery and chest surgery for that matter, then we are saving that blood for people with life-threatening medical conditions or clotting disorders, and may help reduce the blood shortage that affects major cities all over this country year-round.
Let's talk about how this all started.
As you and I talked earlier, this is not zero blood loss, but the important thing is that we not give you blood or blood products. An interesting side to this about 10 years ago in the case of lung cancer was that people who receive blood products for some reason don't do as well with their lung cancer many years down the road. This has been true for other malignancies as well. Our oncologists tell us this may have something to do with altering the immune system. I don't know if it's an effect essentially similar to vaccination or anti-vaccination, but if we're going to change a patient's immunity with a blood product after a cancer operation, then that's certainly beneficial to avoid blood usage. I would say in the lung cancer population over the last 10 years, the surgical need for blood has been essentially zero.
Wow.
And this is hundreds and hundreds of cases.
So, doctor, are people really having surgery without getting blood transfusion and using blood products such as platelets?
Well, no, I think if they come to East Jefferson Hospital, they're coming to a facility that has a very aggressive blood conservation program in effect. And we are going to continue doing this, and it's getting better, I think, day by day as we learn additional tricks, which we share with our colleagues around the country.
So, Dr. Brothers, the benefits go far beyond the patient, right?
Facilities like trauma facilities that may use a lot of blood, you have to use blood in trauma. It's a life-saving event. Any blood that we don't use, again, is blood available to others who need it. And sometimes blood is not readily available in the community. But historically, cardiac surgery have been big users of blood bank products. So anything we do to reduce the use of blood not only benefits the patient, but it benefits the blood banking system that has to provide those products. These are very new and exciting ideas, and I think the time has come for us to embrace them across the whole spectrum of surgery.
Thank you, Dr. Brothers. Truly amazing. For more information, we made it very easy for you. Just go on over to our website. That's ejgh.org.
Thank you, Camille. As always, visit ejgh.org to learn more about this subject and its benefits.